Hello friend, Jim here with JB's Big Adventure coming to you from Lake Chapala, Mexico. I first of all just want to open up this video by saying thank you and how grateful Barbara and I are for you, our viewer, and also our subscriber. The information that we're sharing with you comes from our heart and comes from research and looking into things. The reason you haven't seen a video come from me from 2 to 3 days ago is because of the fact that I would want to make sure that we've got value content for you. It isn't just throwing together a video like so many of those on YouTube do. As a matter of fact, I've seen a lot of those just recently doing that. But we want to take things that are really important to you, our viewer, the individuals that are looking at retiring and looking at retiring here to Lake Chapala, Mexico, but provide you with valuable information that will help make your living here a lot better. Like our heading says, moving to Mexico, living in paradise. So we enjoy bringing this information to you. And today is like no other. I've been looking forward to doing this video because I know it's a real confusing subject when it comes to healthcare here in Mexico. Those of us that are in our 60s and above and the retiring age realize that those of us that are presently living on Social Security and retired, it's really important for us when it comes to our health care. So I've really been doing some research and looking into things for you with facts, not just, again, throwing things together, but some real information. So what I've got is there's basically 3 different categories of healthcare in Mexico. The first one is public free healthcare. The second is public not free healthcare. And the third is private healthcare. I'm going to go through all 3 of those with you. And I've got some visuals that'll be able to help you see that. And we'll go to those in just a moment here. But first what I wanted to do is I just wanted to share with you a couple of the healthcare facilities that are actually here in Lake Chapala. So what I'm going to do is I'm going to share that video with you right now. Okay, so there you've got somewhat of an idea of what the healthcare facilities are like here in Lake Chapala, Mexico. Now what I'm going to do is I'm going to get into those 3 different visuals to really kind of go through the healthcare and what it's like here in Lake Chapala, Mexico. So let's go ahead and go to these visuals, these slides, and I'm going to talk you through those right now. Okay, so as you can see, the one that's on the left-hand side is called INSABI. And it is the Mexican public health care system. And as you can see, there is no enrollment required, although you must be a legal resident, whether a temporal or a permanente, here in Mexico. Now, they've got 3 different levels here, but first I want to go on the right-hand side and just let you know that all of your care first starts at a local clinic. If it's major, it then gets referred to a public hospital. And as long as you've got all the proper ID and such, what they then do is they go ahead and put you in one of those hospitals. Now, what you'll want to do is bring someone who speaks Spanish because they just don't have folks around that speak really good English. A couple things here. One is expect long lines because it is public and it's free. Sometimes they'll be out of medication. Now, they do provide free medications and supplies, and that is really the reason that sometimes they are out. Now, it's not the same exact care as it is in the States, and the care given is at a public hospital facility All medical conditions are treated, and it provides health care at all levels. And the treatments include clinical diagnosis, hospitalization, surgery, and also medication. So the first level you'll see there is basic medical care, doctor visits, and medication. Second level is when it comes to broken bones, and it goes then to a secondary healthcare facility. And then level number 3 is when it actually you go to the hospital, and that's for things that are more serious, heart issues, kidney transplants, severe care conditions, ICU, surgeries, etc. So as you can see, that is public and that is free. Now, let's go to the public, which is the second one, not free. Now, this is called IMSS, and it basically is Mexico equivalent to the U.S. Social Security system. Now, there are no pre-existing conditions accepted. So if you're dealing with that presently, this is not going to be something that's going to work for you. But I am going to tell you who qualifies. Those who work for companies that are here in Mexico, and or those that are self-employed, or those who actually pay into it. Now, it's based solely on your age. And as you can see there, between 0 and 19 of age, it's 4,650 pesos a year. Now, as you'll see that these ages, for example, between 50 and 59, it's 8,450 pesos. And I'm going to focus kind of on this age 60 to 69 and above. Now, that 12,250 pesos actually is in pesos, which is Mexican money. Now, for a couple in their 60s and above, for two, it's right around $65 to $70 a month. Although you are going to pay the amount that shows up to the right of your age in advance the first year. So, as you can see there, it does not cover any types of, for example, eye care, dental, electrical surgeries, which is like plastic surgery, weight loss, infertility treatments, or treatments for self-inflicted injuries. Again, the first year premium is paid in advance, and you must be a temporal or a permanente resident. Okay, now let's go to the third, which is the private healthcare, and it's going to be our third visual. And as you can see, there's a list of quite a few different companies. Now, at the very bottom, I've got there, check with your present Medicare medical health care provider. That's going to be very, very important because it might be that your provider already provides health care here in Mexico. Now, I will tell you that Medicare is accepted, but it has to be Advantage Medicare. And my wife has that here, and it's actually through United Healthcare. So as you can see, there's some of these other logos here of different healthcare opportunities, or I should say benefits, that are actually based here in Mexico, but which starts outside in the States. And again, these are private, so these would all be self-pay. And what I would say to you is I would check into it just to find out for your own peace of mind. For one, is your Medicare accepted in Mexico? And if it isn't, how do you submit to be able to get one of the benefits through Medicare to actually take care of your medical needs here in Lake Chapala, Mexico? So when it comes to medical care, I really hope that this has been helpful for you. I really tried to make this as simple and as easy to really understand and try to encompass as much as I possibly could. But really, I would encourage you to check into, if you're on Medicare, to check into which plans that you would need to be on for your Medicare to be accepted here in Mexico. Now, I will tell you that the medications here are a lot cheaper than they are in Mexico, and I've shared on a few of the videos that we've done that, but I'll share with you, if you've not already seen some of our other videos, you'll want to make sure to go check those out. But there's a medication that I take. It's a controlled substance. And in the States, it's just over $1,200, and that's a month for 30 days supply. Now, that same medication here in the States is actually $95. So that's a real savings. And I can't tell you how many times I've heard over and over again of other seniors and retirees and their medications also being a lot less expensive here in Mexico. So I'd like to really encourage you to go and take a look at yours just to find out where yours is at. And if you've not yet in the Medicare system, obviously there are the options of the free options there for you if that is something that you would like to have the option of being able to take advantage of. So with that being about healthcare, again, I hope it's been real helpful. I hope there's been enough information. If you've got any questions, go ahead and leave a comment. I'd love to hear from you. If there's other things that you'd like to add, I'd love to hear those, because it could always be something that someone else is looking around might find of interest also and say, hey, I'm just like that person too. And, also give a thumbs up, because what the thumbs up does is it works with the algorithm with YouTube, that when someone, for example, is looking for healthcare questions, that your thumbs up on this video helps them find the right video with the right information for them too. So as always, I appreciate you. I really appreciate you coming and again, being a part here. We'd love to have you subscribe if you haven't already. And again, leave a comment. And if you'd like, also hit the bell that way, because you're not going to want to miss any of our upcoming videos. Until next time, have an awesome day. We'll see you on the next video.